welcome to the EMA's Health and Safety Podcast. My name is Rebekah Stevens and I'm delighted to have you with us here today. Our guest is Kevin Chambers, who is our Quality Assurance Manager here at the EMA. Welcome, Kevin.
Hi, how are you doing?
Good. So you're usually the interviewer in our podcast. Today you're in our hot seat. So today's topic, we're going to be talking about training needs analysis for health and safety in your organisation. This is a subject that you teach as part of the EMA's NZ Diploma in Health and Safety Management Level 6.
That's correct.
So, Kevin, why is a training needs analysis essential for health and safety professionals in an organisation?
Okay, so the first thing I'd say is that everyone should be doing training needs analysis on their staff, but it's more important for health and safety workers because of the risks associated with their work. If let's say that I'm someone who works in admin and I make an error, I could have an angry customer, or maybe there could be some revenue that gets mislaid or something like that. But in people that have health and safety as part of their role, they make an error, someone could get hurt, someone could get killed. So the Health and Safety at Work Act says that organisations have a duty of care. They need to make sure that their staff are trained to be able to work safely, and therefore the organisation needs to know, well, what are the capabilities, what are the competencies that our staff need to have, and are we providing enough training for them to ensure that they have those capabilities and competencies?
Very important. So when we're doing this training needs analysis, where should we be targeting it? Should it be organisational, team, individual levels? How should it be targeted?
Yeah, so organisational level perhaps is too large a rock for an organisation to do, particularly if it's a huge organisation. But and again, if we're speaking specifically about employees that have health and safety as part of their role, if we're speaking specifically, about an organisation that has risks associated with the work that is undertaken, then I'd be looking at the team, and you can't do a needs analysis on your entire organisation at once. So choose a team maybe that has the most risk associated with the work that's taking place, and then start doing an analysis on the capabilities and competencies that they have. Often I'm asked then, well, so where do we start? How do I begin this? And I think a desktop analysis is a good place to start this project. It is a project and it will take time. A desktop analysis is where you get into the paperwork, have a look at the job description, what are the knowledge and skills and behaviours that are required of this particular employee or the team members of this team. And then marry that up with the data that you've got on employees. So perhaps when they when they were employed by you, they had a CV. In their CV, have they got the qualifications? Have they got the unit standards? Have they got the experience, the skills, and the areas that they're working in for you? Have a look at their record of achievement from NZQA. There are, of course, certain tasks that do require a worker to have competency in the task. And at this point, I think it's probably important to talk about the difference between someone that's capable and someone that's competent. Is that difference clear to you?
Well, why don't you explain it for us and our viewers?
Sure, I'm happily to do so. So if someone has capability, they've got the knowledge and the skills to do a job, and in this case, we want them to have the knowledge and skills to do the job safely. The only difference between someone being capable and someone being competent is a competent person has now been formally assessed performing the tasks that require those skills.
That's a key difference.
Yeah, and if we use the language that exists in New Zealand, then they've perhaps achieved a particular unit standard, which then says not only can they do it, but they've been assessed against a standard and they are therefore competent in it. A couple of great examples. These won't apply to every workplace that our listeners are working in, but people that are in a distribution centre and that requires them being able to drive a forklift. Well, a little bit like driving a car. You can't do it unless you've got your licence. And a forklift licence requires them to get, I believe it's 2 particular unit standards. Other jobs that would qualify as we need more than capability. We need competency. Would be people that are working at heights, people that are working perhaps with hazardous substances, people that are working in confined spaces. So do a desktop analysis. Find out, well, what data have we got? Do these staff members, do these employees have these skills, and what evidence have we got that they've got these skills? So desktop analysis will, as I said, look through their JD to determine what's required of the job, maybe look through some task analyses that are required of the job, and what are the skills and the capabilities to complete that job safely, and now have a look at the employees. Are they able to do it? Do they have the paperwork, if paperwork's necessary, like working for heights, forklifts, confined spaces? Have they undergone training in this particular skill? If so, how long ago was the training? There are, of course, some skills where in New Zealand employees are required to retrain and retrain again, and the example that will relate to probably everyone that's listening, and certainly even in our organisation, if someone is a first aider, then they need to do the first aid training every 2 years. Every 2 years. So start off with your desktop analysis. What does that tell you? Are there gaps?
Fantastic. And so really we're linking it back to what are the risks, what are some of the critical risks, the high risk activities, and kind of working back from there in some ways.
Yeah, in a way. So what are the high risk activities, and in order to reduce the risk or minimise the risk in these activities, what knowledge and skills do people need to have?
And what level do they need to have?
And what level? It's a great point that you make there. Do they simply need to be able to do the task supervised?
Yeah.
So I can do it. I'm not brilliant at it, but as long as there's a supervisor who's kind of keeping an eye on me, it may well be that for some tasks an organisation is happy for someone to be trained to the level of, I can do it, but I still need to be supervised. Of course, one supervisor can't be supervising 20 people exactly at the same time. So they'll also have staff members where they're like, well, we got 10 people on our team. We would like, we're happy with 4 of them being able to do the job supervised at this stage. Maybe down the line we'll continue to train them so then they can do it unsupervised. But we want the other 6 to be able to do it unsupervised. Of those other 6, we want 2 of them to be able to do it at the level where they can train other people to do it. So yes, there are different levels of having knowledge and skills.
Yeah, absolutely. And then when we think about the particular areas, so we've kind of talked about some of those high-risk activities, should we be including things like psychosocial harm, cultural elements? Should that be included?
Yeah, if the organisation has identified that there are psychosocial risks, then people should be trained to monitor that risk, to be aware of actions, activities, behaviours that may create a likelihood of there being psychosocial harm, and doing everything they can to mitigate that. Absolutely.
Awesome. So really when we're doing this training needs analysis, we're trying to find the gaps that can be plugged with training. So how do we decide that this is a training needs, this is a knowledge needs, this is a skills need? How do we determine that through this process?
Yeah, so you have to look at what the job, and by this I don't mean a person's whole job, I mean a part of their job, a task in their job that has a risk, whether it's psychosocial risk or other, have they got the knowledge and the skills to do that job safely? There are, of course, some risks that you can't eliminate, but do they have the knowledge and the skills to do that job to minimise the risk that's associated with it? And in many cases, the person will have been trained by perhaps their supervisor or another colleague, and they'll have been observed, completing the task a handful of times. There's been no issue whatsoever. The organisation then can feel quite confident that they do have the knowledge and skills to do that particular task. As I said earlier, there are some tasks, of course, that being observed is great, but you need to have the ticket, in which case formal training will be necessary. And the examples I used were first aid training, working at heights, working in confined spaces, forecourse training and stuff like that. The problem with the gap is a little bit to do with conscious competence. Sometimes people think they can do it, but they actually can't. And a saying that I've got is, being confident that you can do something is great, but it doesn't mean that you're actually competent at doing it.
Yes, I agree with that.
And that's often the thing that is the hardest to uncover. And that's why, as part of the needs analysis, you're doing a desktop analysis on what the paperwork is saying, but it doesn't stop there. You also then, I would encourage people to be surveying their staff members and asking their staff members some key questions about certain parts of their role. A very general question would be, do you believe that you've got the knowledge and skills to perform your role safely? And one would hope that A, they would have the knowledge and skills, and B, that if they didn't, they feel comfortable going, well, actually, I am being asked to do this one thing, and to be honest, I don't think I've had enough training. And that's not necessarily a black mark against them or even against the organisation. That's the gap that you want to uncover. You want to uncover that I don't feel comfortable doing this particular thing. I don't think I've got the knowledge and the skills to do it. Other questions that I'd be asking them would be, do you have the knowledge and skills to keep not only yourself safe, but to keep your colleagues safe? Do you feel that you are able to perhaps raise your hand when you see work that perhaps could be considered unsafe, and would you feel comfortable halting that work? And here now we're talking about culture as much as anything else. And the survey questionnaire of your staff doesn't need to be long. It might be 7, 8, 9, 10 questions. And what you're doing is you're getting them to give you some feedback about how they think they're going. Now, of course, some staff members might be a bit nervous. They might go, well, if I put my name to this and I acknowledge that maybe I don't have a particular skill, is my job at risk? In that instance, then it may well be that you choose that for the survey, you make it anonymous. It doesn't have to be related to a particular individual. It could well be you've got a team of 10 people. You give all 10 people the survey, and you go through the survey and you notice that actually there is a percentage, we don't know who the people are, but there is a percentage who, for example, don't feel comfortable stopping unsafe work, or for example, don't feel that they've got all the skills that they need to do their job safely. That then would be a gap, and that would be, well, okay, so now there is an issue. There does seem to be a theme with this particular team. They're great at that. They don't feel confident at this particular task. We need to continue training in that area. It is obviously better if the respondents to the survey do say who they are, because then you can identify exactly who a gap is related to. And I want to make it clear, a gap is not a black mark. It's not something that staff should be worried about. It's more, if we don't find the gaps, we can't fill them. So let's do it.
And you've touched on a really key thing in the health and safety space, is that data around what the gaps are, what are the mistakes, where are things falling over. That data is really important. And like you said, creating this blame-free environment where people feel comfortable to say that is really important.
Yeah, absolutely. And so, we've talked about desktop analysis. We've talked about getting some data from your workers. Let's triangulate that data. Now let's go to their supervisors and perhaps have a quick chat with them, or get them to fill out a similar survey just around their staff, and just going, do you feel that your staff have been trained? And are you comfortable having your staff working unsupervised? Are there tasks that you think, some of your staff members require more training or more support to be able to do safely? Supervisors will then give you a different insight to the insights that you get from the worker, and they'll give you different insights to the insights that you're getting from your desktop analysis. So it's very important that you don't just grab data from one source. You need 2 or 3 areas of where data comes from, and we teach about the data collection when we do this particular module in our diploma. Most of our diploma learners have never done a training needs analysis before. Most of them then, when they start preparing for it and they undergo it, they're like, wow, this is really interesting. It's a really good skill for me to have. I'm the health and safety manager, so I need to have confidence that the workers in this organisation are able to do their complete their roles safely. And and that if there are gaps, then we need to put a plan together to ensure that those gaps get filled.
Yeah, absolutely. And so how often would you recommend doing a training needs analysis?
It's a very, very good question. So if we just focus at the team level, again, let's say that we've done a needs analysis on our team, we've gathered the data. It may well be that you've displayed the data in a live Excel spreadsheet, for example, or it may well be that you're using an app, perhaps Eco Portal or whatever, that collects all that for you. You've now got your benchmark. You've got your line in the sand. We've done our team. Let's say we did our team in June, July 2026 or whatever. That data needs to be updated as the training takes place.
Yeah.
So you found some gaps. Maybe now you've got some formal training for someone. Once that formal training's finished, you'll update that data. Maybe there's some informal training, on-job training, buddying going on. Again, once that's finished, you'll update the data. And that spreadsheet then would be updated as is necessary, as and when necessary. And so a formal needs analysis probably wouldn't need to be done for another couple of years.
Okay.
And that would depend on how much, on how many staff members perhaps you've had to replace. There's been rollover, or if you've expanded your team, or if people have been promoted into other areas and you brought new staff members in. Then again, you would start again there.
Yeah, specific triggers.
Once every couple of years is certainly enough.
Yeah. And then what feedback loop should we have in place? So we've identified all of those gaps. Do we need to go back to those people that have passed with flying colours? Do we need to tell those people that have failed abysmally? How do we communicate that?
That's a great question. So it's not really about passing and failing though, right? It's have you got the knowledge and skills to be safe and to also ensure that the people around you are safe. And so if you've asked staff members to complete a survey, absolutely you need to go back to them and you need to tell them what the survey has uncovered. At an individual level, yes, if you've noticed that there is a particular staff member and there are 2 or 3 gaps, they need to be informed. Yes, we have uncovered the fact that there appear to be gaps here. You've identified a couple of things. Your supervisors identified a couple of things. And then, excuse me, so go back to them and say, well, look, this is what we've uncovered. This is our plan. Don't worry, your job's safe. You're not going to lose your job, but we need to make sure that we now upskill you so that those gaps aren't there. So you would need to go back to them, tell them what the plan is. Their supervisor, team leader, manager, whichever word applies, they would need to be informed as well. What is the plan to fill these gaps? And I should also say, and I'm an educator, people, and so I always want training to be the solution. Naturally, we'd like you to do the training through EMA if that's appropriate. but the point is, sometimes training won't be the solution.
That was going to be my next question.
Yeah. Look, let's say I'm going to be careful how I phrase this. But look, it could well be that someone has a gap, and it's for a skill that they hardly ever use. There might be a particular task that happens. Maybe it only happens 2 or 3 times a year. It could well be that you go, well, look, it's not worth us investing filling that particular skill gap. We have other staff that can do that. So what we'll do is we'll remove that task from your role. And you could well argue that that's a really good decision. It's a sound decision for the organisation. Yep, we could spend $1,000 or whatever and fill the gap, send them on a day's training, but they probably won't do it again for another 6 months. Is there any point? Maybe we just take them away from that particular task and we have other people doing that. There could also be the classic situation where someone actually does have the skills and someone does have the knowledge and they can do it safely, but they're choosing not to.
That's interesting.
Yes, so and one would hope that is very, very rare. But there's always that one person, and in this instance, maybe training isn't the solution to fill the gap. Maybe the solution is redeployment. Maybe the solution is bringing in after a number of other discussions with this worker, why aren't you performing this task the way that you've been taught? Why aren't you not following the SOP? It may well be that, training isn't the solution because there's a reluctance from their part. So it now becomes an HR discussion, where they need to have their performance managed, as opposed to, okay, here's a gap, let's fill it because you've got a lack of skill. In this case, the gap exists because the worker doesn't have the right attitude.
Yeah.
Now that's well out of my area of expertise. But again, there are we do have people at EMA that can help you having those difficult discussions with your staff. But if we're focusing largely, look, people want to do well. They don't want to get hurt. They don't want to hurt their colleagues and peers and friends that we're working with. Training is more often than not is the right solution to fill that gap. The decision then is it formal training where we send the person on a course, so the training is done by an outside provider, or whether it's informal training in the organisation where we pair them up with a colleague, a staff member that does have the knowledge and skills and they learn from them. And there are pluses and minuses from both, and the final thing, just regarding the planning, is I think it's really good to have an idea of when you think the gap is going to be filled.
Yes.
There is a cost involved. It could well be that you're like, well, look, I've got 100 employees and having done all this training needs analysis, I've worked out that there's actually about 50 days of training that's required. Not for every employee, but this person needs 3 days doing this course. This person needs 2. This person needs this, that. So it may well be that you're like, okay, well, that's going to cost a bit of money, and we're going to have to spread that out over a period of time.
Stagger it out.
And that's a nice way of putting it, staggering it out. Thank you. And so, well, okay, which ones do we look at first? Which gaps do we fill first? And clearly they would be the ones that are related to the critical risks. Where the likelihood of harm, likelihood of occurrence and harm are high. Brilliant. Okay, that's got to be first cab off the rank. If there's other areas where there's actually a very small risk, but we do want to fill the gap, then that can happen a little bit later down the line.
And like you're saying, triangulate and kind of decide what's the critical risk, what's sort of a medium risk, and what's a low priority, and kind of working backwards from there. You're not just throwing a dart at a board and hoping for the best. You've got to go at it systematically and strategically.
Oh, absolutely. And so, again, for our viewers, if you are undertaking a training needs analysis, then I would expect you firstly to scope it out with your employer. Just go, well, okay, which teams do you want me to look at? As I've said earlier, like the teams that are at a higher risk associated with their work. And once you've done all your data collection and you've analysed it and you've found your gaps and you've got ideas about, well, let's plug this gap that way, let's plug this gap that way. Here's a bit of a timeline. Then I would anticipate that would be a report that goes through to the senior leaders in the organisation, and that they then sign off on it, so that it can be implemented.
Yeah, absolutely. Some great advice there, Kevin. Thank you very much. Welcome. That brings us to the end of today's podcast. Thank you so much for joining us. If you're looking for more training courses or practical resources, you can have a look at ema.co.nz or reach out to any of our team. We're here to help you create safer, healthier workplaces. Thanks for listening. Until next time.